Hi, this is Adrian with Peace of Mind on Channel 5, and today we're going to be talking about breast cancer awareness, something that's very important because it affects so many people. And if it doesn't affect us directly, it does affect somebody we know. So today on our show we have Crystal with us. She's been on our show before, and she's actually been on other programs as well. So at this time I'd like to introduce you to Crystal. And Crystal, why don't you remind our viewers a little bit about yourself?
I work at the health department, Neosho County Health Department. I'm the family planning nurse, women's health nurse, and so, of course, Breast Cancer Awareness Month is a big deal for us. Every year, we like to remind every woman that they should be getting their mammogram over the age of 40 and following up with their doctor, getting their clinical breast exam, and taking care of themselves.
Very good, very good. And it seems like that's something that you hear a lot about. There's certain cancers that you hear nothing about, but breast cancer you hear a lot more about. So it's something that is preventable, not preventable, but that you can work with once it's detected, right?
Well, if caught early, you have a 98% chance of survival, a 5-year survival rate, which is pretty good for cancer. And if you, like 1 in 8 people, 1 in 8 women can be diagnosed with breast cancer, and so it's kind of a big deal. Everybody knows one person, at least one person, if not more than that, that's had breast cancer, is going through breast cancer.
And that's diagnosed in their lifetime, 1 in 8 in their lifetime?
Yeah, 1 in 8 in your lifetime.
Okay.
Yeah.
So Chanute has a population of, I believe, like, what, 8,500? So we're talking over 1,000 women in Chanute during their lifetime. Think about that for a moment. Over 1,000 women from Chanute in their lifetime will be diagnosed with breast cancer. And if it's caught early, you have a better chance of surviving past 5 years. What are some of the things that are in place to help women find out whether or not they have breast cancer?
Well, we have programs like, obviously, we have mammograms. So if you're getting your annual screening, as every woman should be going to their physician every year, just as a preventative measure, especially over the age of 40, make sure you're getting a breast exam by your provider. Make sure you're getting your mammogram every year. If you have a family history of breast cancer, depending on what age the woman had it, like say you had an aunt or a mother that got breast cancer at age 40, you're going to want to start at age 30. You want to start 10 years before your family history, because you have a really increased risk for it if you have a family history. So
okay. So there's the mammograms that you can have done at the hospital, your annual checks that you should be doing with your provider. And I know sometimes we get the mindset, we, not like I'm a woman, but just people in general, that, oh, I'm healthy. And so they don't have that annual check. And women are, I'm going to get chastised for this one, but a little more high maintenance in the health department. So they have some additional visits with like an OB-GYN, but sometimes those are booked out 2 years out. So even if you feel you're healthy, and even if you go, well, I do my regular checkups without my OB-GYN, make sure that even if you don't get in with the OB-GYN, get in with your regular primary care provider, and get those checks done. But there's also checks that can be done monthly or every day even, really.
Yes, your self-breast exam is really important to do. You know, starting at age like 20, it's really good to do a self-breast exam every month. Usually the week after your period is the best time because they're not full of hormones. Now, some women have lumps and it's normal for them and they'll come and go. And those lumps, you still want your provider to check out to tell you, this is normal, it's not normal. You know, if they have changes, it's something you want to go to your doctor about, definitely, and get checked out, because you can still get breast cancer in your 20s. We have somebody here I know who's going through treatment, and she's in her 20s right now, and so that is,
wow.
You got to know. You got to do it.
And not to compromise any information, did she find this because she was doing her regular monthly? Don't know that one?
I don't know.
That's because they say with the mammograms, they can detect those like that they can detect 3 to 4 times as many with the mammogram as they can with the physical examination. And so that would be, you know, well, would she have noticed this when she was... It's the way my mind works.
My guess is at 24, you're not getting a mammogram.
Probably not. So
she probably had a lump, and then they probably did a mammogram, saw it. They immediately, if you have a lump, they take you to go get a sonogram to see how invasive it is, how big it is. They measure it and all that. Then you go back to your provider, and then they usually biopsy it. And from there, after the biopsy, then you know. And most of the time, these lumps, they're really normal, so your doctor's, you know, really not stressing out about it. I myself, I've had lumps that have been biopsied, and they're fine.
I found a lump.
Did you?
In the shower, and I'm like, okay, I've heard that
Men
it's
can get
rare,
them.
but men can get breast cancer. And so, of course, you know, when for some of us, a certain percentage of the population, like myself, immediately jump to, oh my gosh. And it's helpful when you're married to a doctor, because then you really annoy her about, can you check out this lump? It doesn't matter where you find a lump or what you actually find. So, so yeah, I had a little lump, and I had not my doctor, but my wife doctor check it out. And, oh no, it's just a little lipoma or something.
Okay.
Is that the right word for it? A little...
Lymphoma?
Not lymphoma. No. Lipoma. I think the little fatty tissue.
Okay.
So, anyway, at least that's probably been 5 years now. So if it wasn't, it probably would have gotten more noticeable.
Is it still there?
I don't remember if it's still there. It just
you quit doing them?
Well, it wasn't even like I was doing them. It was like I'm in the shower, and which is a good time. So there was really no reason why you cannot check every day or once a week, just while you're in the shower. You know, get that really deep clean by, you know, I check my feet for lumps, and every, you know, hands for lumps. There's no reason why we can't basically be aware of what changes our bodies having. And aside from lumps, I was reading that if you notice that there's any change in size or shape that's not associated with normal routine hormones, then you know, that could be. And there was something I was reading about discharge, and you know, if but then they said that discharge doesn't necessarily mean cancer, but should go and have the doctor take a look at it.
Because it could always be just a hormonal imbalance. Obviously, if you're lactating because you just had a baby, it's a hormonal issue. But sometimes it can just happen because you have a hormone issue, or maybe there's a problem like cancer.
Well, and with the hormone issue, maybe that might be something that needs to be addressed instead of waiting until it gets out of whack. So you were talking about some statistics before. Is there certain people who are more at risk? Granted, women are more at risk than men.
Definitely. But Caucasian women are most commonly diagnosed with breast cancer, but African American women actually have a higher risk of death, probably because in some groups they may not have the ability to go get the tests, and or maybe they don't have the insurance to go get the treatment once they do find it.
Which would make sense then with the other statistic. If you have more access, then they'll be detected more, detected earlier, and reduce the risk of death from it. Okay. What about age groups? You mentioned something about this other lady was too young what kind of age groups tend to find this more, or tend to when they have breast cancer, maybe more fatal or anything like that?
I think usually over 55 it's more fatal. But definitely at 40 you want to start looking. Over 55, I think your statistics, they drop pretty good on. It's usually a worse prognosis, mostly because your body, obviously, it's older, can't bounce back, and you may have stopped doing your breast exams, self-breast exams at that point, and so you might have caught it later. So.
And I imagine probably as you're getting older, that probably has something to do. Of course, I'm probably speaking really out of hat here, but like if you have a hysterectomy, a lot of times that throws off your hormones.
Hormones. Man,
yeah,
it can really mess you up. But yeah, if you have an earlier onset of a later onset of menopause, that really increases your risk for breast cancer. So I think it's menopause after the age of 55, that increases your risk for breast cancer. Or if you started your menstrual cycle early in life, like before the age of 12, that really increases your risk for it as well.
So it sounds like everybody's at risk.
Well, that's why 1 in 8 people.
1 in 8 people, yeah. And that 1 in 8 people, is that, worldwide, here's the all the information that we gather, or is that 1 in 8 people U.S. statistics? How does that compare to really like Southeast Kansas? I don't
know. When I've looked on the American Cancer Society, I don't think I've ever seen it
show Chanute, Kansas.
Yeah, definitely they don't break it down to Chanute, Kansas, and they definitely don't break it down to Southeast Kansas.
So somebody wants to learn more, whether it's a younger viewer who is like, well, maybe I should start to do these things, or if it's somebody who says, well, I really haven't been doing this for, what do I need to know? The Neosho County Health Department would have information. Do they come see you? What would you recommend for somebody who wants to know more?
Well, they can always jump online. There's a ton of websites online that they're full of great information. Of course, the American Cancer Society has a great website. CDC, if you search in their little thing on breast cancer, you'll immediately get a ton of information. And you can always call the health department. We can refer you to websites or maybe providers. If you're an uninsured woman over the age of 40 and at a lower income, we can talk to you about a way that you could probably get help paying for your mammogram. So, call.
That's the big thing is make that effort. And you mentioned a couple of websites, and that's important to know. The American Cancer Society and the CDC and NIH or different groups like that, because, well, the internet is full of information, and some of it's not always good or accurate or however you want to put it. So it's good to get that information from a reliable source. And also, if you are a husband, a son, a father of somebody who has breast cancer, there's a website out there that is tailored towards the male support for the female with cancer. And for the life of me, the name slips my brain right now. But again, if you Google it, you'll find anything on Google. Pink and Blue, or Blue and Pink, or something like that.
Yeah, that's what you were telling me, something like that.
That's how they're known, and it's a nonprofit organization. And what's nice about that is a lot of times there's information for the person going through whatever illness, whether it's breast cancer or lung cancer or whatever. There's all sorts of support groups for them, but this is really a group to help support the family member to be support to the person going through the cancer. And a lot of times that is, an area where, let's face it, guys, we feel like we have to fix things. And when we get into a situation like this, it's something that we ourselves can't fix. But we're not expected to, But what is important is maybe what can we learn to be supportive in a manner other than trying to fix things. A lot of times women don't need something fixed. They just need somebody to be there. So that's a good resource for us guys to go check out, as well as guys maybe start thinking about what do I need to know if I start to to notice something going on different about my breast area. And would the symptoms be the same for men?
Definitely. You
nipple tenderness or
itching. You can even have like a red rashy kind of area, some warmness. Because there's breast cancers that aren't always just lumps, and so those aren't detected with a mammogram. And so that's why clinical breast exams are, of course, you always start there before you get a mammogram. So it's important to know. Sometimes there's this breast cancer that kind of looks like an orange peel. The texture is like an orange peel. So it's important to know when your breasts go through those changes, this is different. I should go see my doctor.
And just let your wife know that if you're a guy and you're going to start checking yourself, that if she walks in on you in the bathroom and you're testing yourself, that she doesn't think something weird's going on. It could be a good fun thing for couples to
do together.
Yeah, to rebuild that relationship. Thank you.
Friday night, date night has never been the same.
I'm always wondering how far can I actually go on my show. I think that's still fine. I think that's still fine. So yeah, it can be a good thing to. And sometimes we get so busy in life we forget to do things that we should be doing. So if we have that as a sharing moment, a bonding moment, just don't make it become so clinical that
mark your calendar and
Alrighty. Do you have any other information you'd like to share with our guests today and our viewers today? Maybe breast cancer is always a wonderful thing to hear about, but any other things that might be going on within your department at the health department? Any information at all?
We're doing flu shots still, so please come get them. We have open flu clinics on Fridays from 8:30 to 11:30 and then 1 to 3:30. We accept, I think, all insurances that I know of, but if you don't have insurance, it's $27. If you're a business owner and want us to come out to your business, just call us and we do that too. So come get it so you guys don't get sick.
Now, I have a question on that. I was overhearing some conversations one day about flu shots. When would be the best time to get a flu shot? Because there's a push to, what is it, like October 1st or something like that to get flu shots. But the effectiveness of the flu shot, from my understanding, is 6 months. So would it be better to wait till the weather starts changing, which we're currently in?
We are.
Or is there a good time to get a flu shot other than just trying to beat everybody to the punch?
Well, now they're saying that it's lasting a year.
Okay.
So I would guess since it's lasting a year nowadays, you can go ahead and get it as soon as possible. We already have positive flu cases, so you might as well get yourself protected, because from the day that you get your flu shot, it's 2 weeks after that it's effective.
Very good, very good.
So
we do have
get it.
Positive flu cases here in our area, so this is a good time to go ahead and get it.
Yeah.
Okay. And those who are skittish about flu shots or any type of gosh, my brain is not working. Vaccine, thank you. What is the risk of flu shot if there is one, and what is the percentage of risk versus what is the percentage of risk of catching the flu from somebody? Do you have that information?
I don't.
I really kind of sprung this on you, and I apologize.
You did. I'm not the immunization nurse, so I don't study up on those. But I mean, I give them obviously, and I know a good amount of information, but not every little statistic.
No. Well, and WIC. Does WIC help with any of this?
WIC doesn't help with flu shots, but a lot of people who have WIC qualify for like the medical card, and the medical card certainly pays for flu shots.
Oh, okay. So I guess that's about
but one thing about WIC is with all the since the government's up and running again, everything's back to normal with WIC. So no worries. We're printing checks out exactly the way we did before, and no changes have been made at this time. Okay.
Well, that's good to know.
Yeah.
So when, whether it's this month, any month, really do your checks. Make it more fun, make it more exciting. But just do your checks and notice any changes. Notice any changes that happen throughout your whole body, because there may be a reason for that. And when we have these changes go on, it may be nothing, it may be something, but get it checked out. It's easier to take more control of the situation, to have a better fighting chance when we find these things early than if we wait and they start to spread or become something that's more to deal with. So from Channel 5, this is Peace of Mind. Thank you and have a good day.